Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Dr. Sarah Myhill qualified in medicine with honors from the Middlesex Hospital Medical School in 1981 and has since focused tirelessly on identifying and treating the underlying causes of health problems, especially the diseases of civilization, which with we are beset in the West. She has worked in the NHS and in private practice, laterally as a naturopathic doctor, and for 17 years was the Honorary Secretary of the British Society for Ecological Medicine, which focuses on the causes of disease and treating through diet, supplements, and avoiding toxic stress. She helps run and also lectures at the Society's training courses and lectures regularly on the organophosphate poisoning, the problem of silicone, and the chronic fatigue syndrome. She's the author of several books, including Sustainable Medicine, Whistleblowing on the 21st Century Medical Practice, based on the premise that the 21st century Western medicine is failing to address the root causes of disease, and also Diagnosis and Treatment of Chronic Fatigue Syndrome, Myalgic Encephalitis, and Long COVID, third edition. It's mitochondria, not hypochondria. You can find Dr. Myhill primarily on her website at www.drmyhill.co.uk. Dr. Sarah Myhill, what an absolute honor it is to welcome you to Boundless Body Radio.
Oh, thank you so much, Casey. I'm very happy to be here. Let's hope you ask me some nice, difficult questions.
I will try my best. I'm following up on one of the best in the business. You and I were talking about how I learned of you and your work through Jesse Chappis, and you were just on his show. And he's just like one of the best in the business at asking great questions. If I can do even a small percentage of a good job that he did, I think we'll have a great conversation today. And some of the things that you were talking about in that interview were absolutely like blowing my mind. I couldn't believe some of the topics that you've gotten into. And we talked about, in the introduction, that you have developed over the course of your career somewhat of a distrust in the medical system. I'm just kind of wondering how that kind of came about for you. You qualified in medicine in 1981, so you've been doing this for a very long time. So I'm just curious how that journey unfolded for you.
The journey that started at my very first surgery as a general practitioner, when I walked into, and my patients started saying to me, why do I have headaches? Why do I have arthritis? Why do I have chronic fatigue syndrome? And I had to admit, I didn't know, because medical education is not an education, it's a brainwashing. And it's worse than that. The educators of doctors and the doctors themselves are bankrolled by Big Pharma. And as soon as Big Pharma gets involved, it's the old story, follow the money. Big Pharma does not want healthy people. Big Pharma wants unhealthy people who need drugs because, again, follow the money. And I realized that was how I had been trained. I had been trained to use drugs to symptom suppress. So yes, short-term gain, but long-term pain. Because if you suppress symptoms, then you basically hide the underlying pathology. And you actually allow that pathology to accelerate and to progress. So, so from the very first day, I realized that doctors were not addressing root causes of symptoms. And, fast forward to today, I now know that all Western disease is largely preventable through good diet, good micronutrients, reducing toxic stress, and so on and so forth. And so now I practice naturopathic medicine, which is all about asking the question why, and I get great results from my patients. But it's all about teaching people to work things out for themselves. That's why I'm so happy to do shows like this, because if I help one person as a result of talking for an hour, then that makes it all worthwhile.
That's amazing. Wow, good for you. I'm curious what sets you apart from other doctors. Do you think other doctors also grapple with the fact that they are just, slinging drugs? Or do you think it's just something that passes them? Or do you think it's something that they realize and then they realize what a hard and difficult position they're in? What they're doing for business, their livelihood, is not necessarily helping people. Do you think most doctors have to grapple with that at some point? Or do you think they just are ignorant to that fact?
Well, that's a very, very good question. But what I can tell you is that my approach to medicine has got me into terrible troubles with the powers that be. Because if I think something is wrong, then I will shout about it and I will tell the whole world about it. But when doctors shout about things that they think are wrong, they get done by the General Medical Council, which is the body in this country that regulates doctors. So we now have many doctors that have been struck off because they have publicly voiced their concerns over the COVID jabs, for example. I have been, for my sins. I'm the most investigated doctor in the history of the General Medical Council because, and the present score is Myhill 39, GMC nil. You know, no patient complaint, nobody harmed. And in fact, one of the funny quotes that came from a Freedom of Information Act search from one of the GMC's legal advisors was, the problem with the Myhill cases is that all the patients are better and none of them will give witness statements. So speaking out against the things that doctors do is a very dangerous business, because you risk losing your professional reputation. I've been suspended by the General Medical Council for my advocacy of vitamin C and vitamin D. And if I was working within the NHS, I would no longer have a job. And of course, doctors are in this country, the NHS is how 95% of doctors are employed. And they are dependent on a regular salary for their mortgage, for their kids at school. So they are financially incentivized to conform. And if they don't conform to the narrative, which is driven by big government and big pharma, then they get struck off and everything is lost. Now, I don't know if you know Dr. Asim Malhotra, who's currently Bobby Kennedy's right-hand man. I remember talking to him, and one of the things he said is, when you know the truth, you must let go of the consequences. Now, he has suffered too. He's been hounded by the General Medical Council, but he stood up to it, and he's managed to escape to America, and where he can do a proper job over there. But it's difficult being a black sheep. As soon as you step out of line, you get done. And I was very lucky, because when the GMC came after me, I had an independent practice. I could make ends meet. Had enough patients who were supportive of me, and my daughters by then had left school and gone to university, so I didn't have any major financial commitments. So I was fortunate in that respect. But I've been fighting the powers that be for the last 25 years.
Wow. It's amazing. So grateful for people like you and Dr. Malhotra that do speak out and are taking on some of that risk. But yeah, I love that saying with Dr. Malhotra of like, once you know the truth, you can't worry about what's going to happen afterwards. And I don't want to miss this. I find this very curious. If I were to ask 100 people on the street if vitamin C was a good thing for them, I think all 100 would say like, yeah, it's probably a good thing. What is it about the two things you mentioned, vitamin C and vitamin D? Those
Yes.
seem like very universally considered safe, effective, promoted. Fruit snacks, for example, at the store will have a little label that says, oh, vitamin C is in here. Or most people know that like vitamin D is a good thing for you, and most people are aware of vitamin D supplementation. What is it about those two things that gets the medical community fired up?
Because they work too well. I mean, I'll just give you an example of something that happened in the 1980s in this country was fund holding. And what that meant is that doctors controlled the money supply, and many of them set up their own pharmacies. And that meant they were financially incentivized to prescribe drugs. And I can remember one GP saying to me, oh, if a child comes in with a runny nose, we make jolly sure they go out with a bottle of paracetamol, with an antibiotic and a cough mixture, because that makes us 10 quid a time.
Wow.
That is wrong. Doctors should not be financially incentivized by the treatments that they offer. And of course, I'm saying we can do this just as well, far more safely, far more efficaciously with vitamin C and vitamin D. They're inexpensive, harmless in the doses that I recommend, and do a great job. But the doctors themselves don't want to hear that, and neither do Big Pharma. And of course, the General Medical Council, the Medicine, Health and Regulatory Authority, which is supposed to regulate drugs in this country, they are bankrolled by Big Pharma. So they have the power, and they say these things because they can, and they do, and they have the power to ruin doctors' lives.
Wow. Wow, that's just wild. I was wondering if that was the answer you were going to come up with. So I really appreciate that. Again, in the introduction, we mentioned the diseases of civilization. I think most of our audience will be quite aware of what those things are. Tell us about chronic disease, why it's so rampant, why I see it everywhere around me when I go to the grocery store, the airport. It's almost, I mean, not almost, it's way harder to find like obviously healthy people in the crowd than, the people that aren't healthy. And in your mind, what are the culprits that got us to where we are today?
Okay. Now, there are two mechanisms that drive most pathology, including cancer, heart disease, and dementia. One is all about energy delivery mechanisms, and the other is about inflammation. So I learned much of this through my interest in treating people with chronic fatigue syndrome. And fatigue has almost become the new norm. We are a fatigue society. And so I'm interested in the mechanisms that result in that. And the analogy which I like to use is the car analogy. So for your car to go, you've got to have the right fuel in the tank. That's all about diet and gut function. You've got to have some oxygen there, and that's all about breathing techniques. You've got to have the mitochondrial engine, and that's my special area of interest. That's where I have published 3 papers and written books about, because mitochondria take fuel and oxygen from the bloodstream and convert that into energy. And then we need the thyroid accelerator pedal that controls how fast our mitochondria go, and the adrenal gearbox that allows us to gear up to stress. But the single most important thing is the fuel in the tank. And the problem nowadays is that we are fueling our bodies with sugar, carbohydrates, and highly processed foods. And as they get burnt in mitochondria, they produce a lot of free radicals, and we know how damaging those are. Much cancer, much heart disease, much dementia is driven by free radicals and high blood sugars. So if people listening to this podcast, if they did nothing other than cut out the sugar and the carbohydrates in their diet, they were doing themselves a huge favor. So dementia, for example, is now being described type 3 diabetes. Much of it is sugar damage in the brain. Heart disease is all about sugar damage to arteries. Sugar is sticky stuff. It's sticky in the hand and it's sticky in the bloodstream, and it sticks to the lining of arteries and damages them. And when you're eating sugar all the time, your hormones are spiking. First you spike insulin, then you spike adrenaline, and that drives high blood pressure. So sugar and high blood pressure damage arteries, and yes, that results in heart disease and also vascular dementia. And then we have cancer. What makes cancer cells different from human cells is cancer cells can only run on sugar. That is their fuel. Okay, they can get, in advanced cases, we have to think about glutamine, but for 99% of people, if they did a low sugar, low carbohydrate diet, I could almost guarantee they're not going to get cancer. And that's a very important thing to know, because by the time you've been identified with a cancer, by the time you've got a tumour, wherever that may be, breast, lung, gut, whatever, you've literally got billions of cells there. And yes, obviously you have to have the surgery, the radiotherapy, or the chemotherapy, whatever, to reduce that tumour load. But if you then go on to a low carbohydrate, a carnivore diet, a ketogenic diet, a sapiens diet, whatever you want to call it, you can massively protect yourself from secondary deposits. So, the single most important thing is diet. And probably the second most important thing is good sleep and exercise. Yeah, so important. And here's another really important thing about diet, because whenever I have a difficult question, I always go back to the first principles of evolutionary biology. Now, what constrained populations in our evolutionary past is food supply. And so we had to evolve strategies to optimize that. Now, when food was abundant, and guess what? In the autumn, it was abundant. We had a free windfall of fruit from the trees, root vegetables, cereal grains, nuts, seeds. It was abundant. And it switched on the carbohydrate addiction gene. And that meant we just ate and ate and ate. And that is survival value for the winter, because you eat and eat and eat, you get fat. And if you get fat, then obviously that's your food reserve that's going to help carry you through the winter when those foods are scarce. But there's another aspect to this as well, because what nature doesn't want you to do, or evolution doesn't want you to do, is to go and do a load of exercise and burn it off and waste that energy. So eating those foods in abundance makes us fatigued. It's an evolutionary survival principle. So it's very counterintuitive. But when you eat a lot of food, yes, you get fat, but you also feel fatigued. But by contrast, when the food supply is not there, what you need to get food is you need physical energy and you need mental energy. You need to be clever. You need to learn to cooperate, to hunt, to track down, to set traps, to throw sticks and stones and spears in order to, run down your prey. And so when you're fasting, when you are hungry, you actually have better brain power and more physical energy. Now, none of us like fasting because it's not nice feeling hungry. But again, it's an evolutionary tool that we need to survive a famine, because the clever people and the fit and the active people with loads of energy, they will survive. They will make that kill or find that new food source or whatever is necessary in order to survive. So we should live our live our lives with feasting and fasting. So we shouldn't be eating 3 meals a day. There are times when we feast when food is abundant, and then there are times when we fast. So the general principle that I suggest to people is, first of all, eat a low carbohydrate diet. We should all be doing that all the time. In fact, I have my personal addiction test for foods. And my addiction test for foods is that, if I have one bit of that food and I can't stop eating it, then I'm addicted. So if you gave me a bar of chocolate with, say, 30% chocolate, if I had one piece of that, the whole bar would disappear. If you gave me a bag of cashew nuts, which we know are high in carbohydrate, if I had one cashew nut, the whole packet would disappear.
Yeah.
So I use that as my test for what foods are safe for me. And we need to be on a non-addictive, low carbohydrate diet, and we need to fuel our body with fat. If you're in any, I mean, I recommend what I call a paleo, because it's free from dairy products and grains and yeast, which are not evolutionarily correct foods. So paleo, ketogenic, so low carbohydrate diet. But for some people, what suits them best is a carnivore diet, which is also paleo ketogenic. I mean, the bottom line is, again, humans evolved as hunters. There's a wonderful book called Why Vegans Have Small Brains.
I've interviewed the
And
authors of that book. They're great.
yeah, and they make the point, we didn't evolve to become carnivore, we evolved because we were carnivores. And for my sickest patients, very often the carnivore diet is a fantastic starting point, because it's low allergen, it's low carbohydrate, it's got meat and fat, it's very easily digested. We have a carnivorous gut, don't we? Our guts are more like a dog's gut or a lion's gut. It's not like a cow or horse's gut. It's designed to deal with meat and fat, and they are the evolutionarily correct foods. And for many of my sickest patients, that's a great starting point to get them well. And paleo and carnivore is all the talk these days. And people have been brainwashed into thinking, we've got to have our fiber for the microbiome, and we've got to have our vegetables, we've got to have our fruits. It's just not the case. We can function fine eating carnivore. So so that's often a good starting point.
What a wonderful explanation. I absolutely love that. And yeah, I can confirm I've been carnivore for over 6 years now, and I absolutely love it. It's very easy. You really just don't need plant fiber. You just don't. I go off my diet here and there and have other things. And, the point that you made about the seasonality of fruits and vegetables in particular, like, first of all, thinking that most vegetables that most people recognize in the store weren't even around like a very short amount of time. Like, when was the last time you were out on a hike and you just saw like a patch of broccoli growing spontaneously, right? Like, these are bred and would not have been recognized 150 years ago the way we recognize them now. And I give the example of, like, I when I'm going on walks in my neighborhood, sometimes people start gardens and then they'll leave and move and whatever, and a tomato will fall on the ground. And they're absolutely delicious around here. Tomatoes are disgusting from the store. They're amazing when somebody starts a garden. It's a ton of work. They have to work in the hot sun, hours and hours and hours and hours for a tiny yield at a certain time. And I've made the point that these tomatoes are so good and delicious, and I'll have one every now and again. And then there's going to come a day in October, inevitably, where I still like tomatoes a lot, and there's a hard freeze, and the tomatoes are done. It doesn't matter how much I like tomatoes. On October 3rd, I liked them just as much on October 2nd, but on October 3rd, they are not available. They're done. If I didn't save any and they go bad super quick anyway, I don't even have that option. I don't think people realize how little actual plant foods grow, even in tropical environments, even in warm places. It's just, you don't see tons and tons and tons of fruits everywhere. So I think that point that you made earlier, that like, when you get it, you do want to attack it. That sugar creates that drive. You take riskier behaviors and all that stuff because you want to get at that food to get fat so that you can live through the winter the way you mentioned.
Correct. That's absolutely it. And we eat and we're carbohydrate addicts because we can, because there are supermarkets. And the shameful thing is, the food manufacturers themselves want to sell addictive foods, and this is where highly processed foods come in. And they're highly processed, not because they're nutritious, not because they're good for you, but because they create the right sensations in the mouth when you eat them. So initially our mouths and our taste buds and our noses are fooled by the texture, by the sweetness, by the saltiness or whatever. But what's so interesting is that our satiety hormones are not fooled. So when we swallow that food, the body says, oh, that was a load of rubbish. I'm not going to give you any leptin. I'm not going to give you any ghrelin, which tells you you've eaten enough, because that food isn't going to do me any good at all. Go and eat again. Go and try again. So it switches on further addictive eating. So people go and eat more highly processed foods and more highly processed foods. And what happens? Obviously, they're going to get overweight. And just being overweight and fat, that alone will drive inflammation. And inflammation is the second big major mechanism that drives pathology. So it's all about energy delivery mechanisms, which we've touched upon, and inflammation. And our immune systems are in a state of chronic inflammation. We live in an inflamed world. And we live in an inflamed world because A, we're all poisoned, and B, we are all immunotoxic. The immune system has been switched on, and it's been switched on by the medical profession, basically. And I think the biggest driver of that are jabs. But sugar is a major driver of inflammation. And, I can't tell the difference between the brain and the immune system. They are very similar organs. And I think that just like the brain has moods, so the immune system has moods. So if you've got a happy brain that's jolly and got lots of energy, so is the immune system. A happy immune system, it's jolly, it's got lots of energy, and you will be resistant to disease. But if your brain is depressed, if it's miserable, if it's sad, so will the immune system be depressed, miserable, sad. And we know those people are much more susceptible to infections and indeed death. So what we're all taught at medical school, and I can remember thinking at the time, well, that's odd, what's all that about? Is if you have a couple who've lived together for many decades, if one of them dies, there's a very high risk of the second one dying within a year, because they've lost their lifetime partner, and they're sad and think, what's the point of life? And if you're sad and what's the point of life, guess what? You're going to die. So having a brain that functions well, an immune system that functions well, again, much of that is about energy delivery mechanisms. For your brain to, although the brain weighs just 2% of body weight, it consumes 20% of all the energy generated by the body. It's massive. And if you impair energy delivery mechanisms, the first thing you get is foggy brain, can't think clearly, poor short-term memory. And guess what? That's the early symptom of dementia. Now, I know I can reverse dementia at an early stage. Obviously, by the time somebody's been demented for years, it's a much more difficult prospect. But the early dementias we know we can reverse. And there are three important things to prevent dementia and to reverse it. Number one is a ketogenic diet. The brain is full of fat. It's full of cholesterol. The brain is fat loving. It's full of, and we need fat for it to work, particularly arachidonic acid and AA and DHA. And we can get those from fish oils. So first, low carbohydrate diet. Secondly, fish oils. But you can also get those great fats from eating animal feeds, particularly offal. When people do a carnivore diet, they forget that the most nutritious part of that is to eat bone marrow, and if you can get it, to eat brain as well. But certainly liver, certainly kidney, certainly heart. That should all be part of a carnivore diet. Third thing is measure the homocysteine. Now, homocysteine is a marker of the methylation cycle. And using the car analogy, that's how we heal and repair. So, we damage our bodies all the time just by, being alive, by using our bodies physically, by using our brains. Of course, it creates damage. You can't use a car without it creating some wear and tear. And it's during sleep that we heal and repair. And that's where the methylation cycle is so vital to allow us to make those new fresh proteins, to rebuild damaged joints, rebuild damaged tissues, recreate enzymes that become necessary for recovery. So, and everybody should know what their homocysteine is. Now, the shocking thing is, in this country, if you go and see a doctor, they don't even know what a homocysteine is, let alone how to measure it. There's a wonderful website called Food for the Brain that's set up by Patrick Holford that details how you can, and from that website, you can get a do-it-yourself kit, so you can measure your homocysteine at home. It should lie between 5 and 10. If it's too high or too low, you're a poor methylator. How can we fix that? With B vitamins. Cheap, simple, easy. But again, Big Pharma doesn't want you to know that. Big Pharma wants sick people. Homocysteine, we know, is a risk factor for over 100 diseases. Why? Because so many diseases are associated with, well, I can't heal and repair. So simply doing those three things, you can massively reduce your risk of dementia and reverse it in the early cases. And guess what? Homocysteine and poor energy delivery mechanism is also a risk factor for cancer and for heart disease. So, we have these very, very simple nutritional things that we can all do. And I'm going to tell you a joke now. About
All right.
25 years ago, I read a newspaper article about a merchant bank who wanted to target its 100 wealthiest customers for a new investment scheme. So the letter was written. The letter was then sent down to the mail merge department, so everybody could get a personalised letter that looks if it's from the chief executive. But the scruff in the mail merge department forgot to press the mail merge button. And so their 100 wealthiest clients received a letter that opened up, "Dear rich bastard." Now that's been subsumed into my language. And so, I have patients who come to me, and some are RBs, some are rich bastards, but 99% of them are PBs. They're poor baskets. They can't afford expensive interventions. So I'm trying to evolve a system of medicine which is available to everybody, which is affordable, which can be incorporated easily into your everyday lifestyle, i.e. it's the most frictionless path. I mean, yes, I know there are doctors who say, "Oh, I can cure you," and you go over to South America and you spend 20,000 quid on stem cell therapy and you do this. It's not possible for most people. So I want tools of the trade for PBs. And those tools of the trade always start off with with diet. It's got to be low sugar, it's got to be low carbohydrate. Now, I know some people say, "Oh, well, meat is expensive and vegetables are expensive." Yes, they are more expensive than eating addictive food, which is deliberately kept cheap so that people can get hooked on it. But if you're going to spend your money on anything, you want to spend it on food. And when you get the diet right, the need for expensive supplements becomes so much less. So so having got the diet in place, then I have a standard package of supplements that I like everybody to take, as I call it, just to get them on the starting blocks. You see, the problem with modern farming is that there is a one-way cycle of nutrients from the soil into plants, into animals, and then we throw it away. We pollute our rivers, we pollute our seas. And the mineral content of soil has fallen progressively over the last 125 years. So that means the vitamin content of food is going to be low, the mineral content of food is going to be low, the essential fat, the nutritional quality of food is not what it should be. So having bought the best food we can possibly get, we then need a few supplements just to, say, as I call it, get us on the starting blocks. So good multivitamin and a good multimineral, just for starters. And then, like, if you're not eating fish, then you should be taking some fish oils. But oily fish is great. And the acronym to remember is SMASH, smash it: sardines, mackerel, anchovies, salmon, and herring. They're all the oily fish. And then vitamin D, 10,000 IU. Why? Because we don't get enough sunshine. We're all sunshine deficient. Let's go back to evolution. Primitive man evolved walking naked under the African sunshine for 12 hours a day. I'm lucky if I got 10 minutes of sunshine today because I've been working in my office. Vitamin C. We're all deficient in vitamin C. Why? Because it's humans, guinea pigs, and fruit bats that cannot make their own vitamin C. And so my little dog Nancy, who I feed a carnivore diet to, she can make her own vitamin C from protein. The protein gets converted to sugar, the sugar gets converted to vitamin C. So can the cows I'm looking at, so can my horse, so can my chickens. They can all make their own vitamin C. Humans lost that ability. So for optimum function, we need vitamin C. And I reckon about 5 grams a day is about right. Not determined by me, but determined by Linus Pauling. Very clever guy, won 2 Nobel Prizes for his work. He was only beaten to a 3rd Nobel Prize by Watson and Crick, who discovered DNA.
Not bad.
But Pauling devoted the last third of his life to his advocacy of vitamin C. Very important. And the third one we should all be taking is some iodine. We are all iodine deficient without exception. In fact, iodine deficiency is the commonest cause of mental deficiency throughout the world. And I use Lugol's iodine, 15%, 1, 2, 3 drops last thing at night, gives us a sufficiency of iodine. Now, some people tell me, oh, those doses sound a bit high. But the bottom line is in those doses, the potential for harm is 0. We can only do good. And those supplements are relatively inexpensive, completely safe, but most importantly, they do lots of good jobs. So I'll just give you an example. One of the problems with a high carbohydrate diet is we overwhelm the ability of our gut to remain sterile. Our stomach is acid, and when I say acid, it's extremely acid. It might be even pH 2 or 3 or even 2. It's almost like conch sulfuric acid, which if you poured on a desk, a wooden desk, it would bore a hole in it. It's extremely acid. And the reason for that is we want to keep our gut sterile or near sterile. It's a carnivorous gut. Now, if we're eating all the time, snacks, lunch, another meal, snack, the stomach is never empty, and we eat a lot of carbohydrate, we overwhelm the ability of the gut to remain sterile. And the microbes that we eat with food, which is inevitable, all food's got some bacteria and some yeast on it, then the upper gut will start to ferment. And that is a disaster. Because if you've got a fermenting upper gut, then foods get fermented to produce a whole load of toxins, and we become poisoned. So the classic example is if anybody settled down and ate a pound of grapes, you would immediately dilute the acid in your stomach. The yeast on the outside of the grapes would start to ferment the sugar on the inside of the grapes, and you would produce ethyl alcohol. And that's a major cause of foggy brain. And of course, it's a load that the liver then has to deal with. But it's not just ethyl alcohol that's produced, it's propyl alcohol, it's butyl alcohol, it's ammoniacal compounds, it's D-lactate, it's hydrogen sulfur, it's a whole range of nasties that literally poison us. Now, the liver does a great job to detoxify, but that demands a huge amount of energy. And so often when people tell me when they get their upper fermenting gut sorted, their foggy brain goes, because the amounts of toxins you produce are substantial, and the liver doesn't have to spend so much energy detoxifying, so you've got more energy for you to have a life with. So they're energized and their brain clears up. Well, that's a great start. That's a great start. But I think another major problem is that the microbes themselves can get from the gut into the bloodstream. Now, the best example of this is, you ask any dentist, if you brush your teeth, you can find dental bacteria in the bloodstream, a couple of minutes afterwards. So bacteria in the mouth get into the bloodstream. And of course, the dentists are always worried that will drive heart pathology. So anybody with a heart lesion is told, got to have antibiotics for any dental procedure, and probably quite wisely. But again, if you're on a keto diet, you don't have those microbes there. They can only run on sugar. But it's not just dental microbes, it's microbes from the stomach, from the small intestine. And they can get into the bloodstream, and they can get stuck at distal sites. So if they get stuck in their muscles, it drives painful muscles, which we call fibromyalgia. If they get stuck in the joints, it drives inflammatory arthritis like Reiter's syndrome, like ankylosing spondylitis, like rheumatoid arthritis. If they get stuck in the lungs, it can drive intrinsic asthma. If they get stuck in the gut wall, you get inflammatory bowel disease. If you get stuck in the kidneys, you can drive nephritis. If they get stuck in the brain, that drives psychosis. And what's so fascinating, and this is some lovely work done by a Japanese researcher called Nishihara, if you get those microbes stuck in the brain, there they have the potential to ferment brain neurotransmitters into LSD and amphetamine-like substances. And that explains psychosis, schizophrenia and mania. And guess what? Physicians like Abraham Hoffa, like Karl Pfeiffer, they were curing, not treating, they were curing manic depression. They were curing schizophrenia with a ketogenic diet. And some fish oils, guess what? And guess what? Sorting out their homocysteine, guess what? And guess what? Improving energy delivery mechanism with mitochondrial supplements like vitamin B3 and high-dose B12. So the point is, the power of this approach is unlimited. We can prevent and treat many major pathologies. We can normalize life. It's incredibly powerful. And the really important thing from my point of view is you don't need a doctor to do it. You can do it yourself. And this is why, I've evolved a website and books, because, doctor comes from the Latin docere, to teach. I need to teach people to cure themselves, and also to convince them that they have the power to do it. I mean, one of the problems with our NHS, and when it was set up in 1948, it's a great institution, and my grandparents were both doctors, and they said that was the best day of their life when the NHS came into existence, because suddenly they could treat patients without them having to pay. But it's been taken over by the drug companies, so that the responsibility for getting people well, it's the doctor's job. I can do what I like, I can eat what I like, I can smoke what I like, I can drink what I like, give me the pills. And the awful thing is the doctors have got sucked into that. They believe that themselves as well. So what I'm trying to do, and this is why I love giving interviews with guys like yourself, Casey, because you are asking the right questions. You are saying, no, I have everything in my body. All I need is the knowledge to allow the body to heal itself. And it wants to, and it can. And guys like you can turn around people's lives by giving them access to that knowledge. So that's why I'm super happy to be here, because if we can help one person, then this is worth an hour of my time.
Well, it's definitely worth an hour of our time as well. You are treating our audience to an absolute clinic. So I'm absolutely loving this. That was such a great explanation. When you talk about the acidity of the stomach, I think this is really, really important. A lot of people miss it. I agree with you. I think it's a great evidence to say that we are carnivorous. We line up more along the lines of like scavengers for that kind of pH, which is also, you're describing the acid and how acidic it is and how it can eat through everything. So that's quite a bit of energy that we need to keep, the acid in our stomach, which we would have evolved with. And so I'm just curious, like we know that people that go plant-based or go vegan for a very, very long time, can you explain what kind of happens to their gut and the problems that can happen later on when they decide that veganism, for example, is failing them and they need to start consuming animal products again?
Yep. Well, the problem with vegan diets is they end up powering their bodies with sugars and carbohydrates. And that is not evolutionary correct. And as I say, if you've got all these sugars and carbohydrates, I can guarantee they will have an upper fermenting gut, for certain. And that produces a huge energetic drain on the body, because, as I say, the liver has to be very busy to detoxify all those products of the fermenting gut. And again, plant foods are relatively toxic. We think plants are terribly healthy, but they're full of phytates and tannins and lectins, which are actually toxic. And the reason for that is, look at life from the point of view of a plant. Okay, if you're a plant living out, in the jungle, you don't want to be eaten. And what attacks plants are obviously animals eating them, but also fungi, bacteria, viruses that would all like to make themselves, at home, in that plant, which is supplying them with food and water. So most plants are far too toxic for humans to consume them. There are any number of plants out there, but I can't eat grass. I can't eat the hedgerows. I can't eat those trees. At least I'd be poisoned by that. There are a few plants that the humans can deal with, but it requires a lot of energy. And if you haven't got the energy to deal with those toxins, then they will poison you. So a vegan diet is not all that it's made out to be. They talk about superfoods, but the real superfood is liver. The real superfood is bone marrow and brain. If you can eat that, then you're doing yourself, a great favor. So you'll get away with a vegan diet for a while, but you will run out of essential fats, which is essential for the brain and also for the immune system. The brain and the immune system, I can't tell the difference between them. Eating brains and eating bone marrow is equally nutritious. The phytates and the tannins in vegetable food chelate up minerals. So it's much more difficult for the body to access those vital minerals that it needs, like zinc, like selenium, like chromium, like manganese. So that's another problem. And then, of course, they're all going to have fermenting guts because it's a carbohydrate-rich meal. And that puts a huge strain on the body because our gut is not evolved to deal with fermentation. A little bit in the large bowel, yes, but that's just the last 5 foot of gut. So there's about 30 foot of gut from the mouth to the anus. So what it means is the first 25 foot of gut should be sterile or near sterile to deal with meat, to deal with fat, and a little bit of starch and carbohydrates. A little bit, I emphasize. So the food pyramid is completely upside down. The risable food pyramid. So, you've got to have lots of, grains and potatoes and pulses and then a little bit of meat at the top. Rubbish. We need to be powered by fat, by meat, by eggs, by fish, and then a little bit of vegetable if the gut is healthy, and a little bit of fruit too, for the joy of it. And that would be an occasional thing. So when it's in season. But that, as I say, is the evolutionary care suited for our gut. And the vegans, almost invariably, they're deficient in vitamin B12. B12 is essential for the brain. Essential for the brain. It's essential for the methylation cycle. And the vegans are going to have the highest homocysteine, which, as we've discussed, is a risk factor for over 100 diseases. We know it's going to be deficient in minerals because they're going to be malabsorbing them. We know it's going to be deficient in fats, and that's why vegans have smaller brains. And the bottom line is, it's not an evolutionary correct diet, my vegan patients. In fact, as you know, I specialize in patients with chronic fatigue syndrome. And together with John McLaren Howard, brilliant biochemist, we developed a mitochondrial function test. So the mitochondria are the engines of our bodies. It's the mitochondria, every single cell pretty much in nature, bar a few rare bacteria and yeast. Every single cell in nature is powered by mitochondria. It's a universal engine. So the mitochondria in my body is the same as the mitochondria in that blade of grass, in that cow, in my dog, and so on. And John McLaren Howard developed a mitochondrial function test to see how well mitochondria work. And what was so fascinating is that those people who had the worst fatigue had the worst mitochondrial function, and vice versa. Now, we published 3 papers on this subject. I collected 1,036 patients who had all these mitochondrial function tests. And when I went back through the results, a third of them were vegetarian or vegan. Wow. And that's much higher than the population. That fact alone tells me that being vegetarian or vegan is a major risk factor for chronic fatigue syndrome and ME, and will make them, they will just be naturally fatigued. Now, you can function for some time on a vegetarian or vegan diet, maybe a few years, but it catches up with you eventually. It is not a healthy diet. Just to illustrate this point, Mike Morton, keto-adapted athlete, he holds the world record for the furthest distance run in 24 hours. He ran 172 miles in 24 hours. Goodness. He didn't need to eat. He needed water and electrolytes, but he just ran and ran. He could do it on his fat supply. And again, this relates to our evolutionary past, because I say the reason that humans developed their brains they did is because they were carnivore. And if they were running on ketones, then they could run and run and run. And humans, they couldn't run down their prey in a sprint, because all animals are faster than humans, but they could outrun them. They were persistent hunters. And they could run and run and run. And being naked, they could lose heat, they could sweat. Whereas the hairy animals would get hotter and hotter and hotter. They could only lose heat by panting, and eventually they would overheat and come to bay. So, and again, by running on 2 legs, that freed up our arms so we could throw sticks and stones. Now, if primitive man could bring down a large herbivore like a bison or a mammoth or an elephant, that one beast can supply about 5 million calories. That's going to keep your tribe going for a month. So for very little, for maybe a day's hunting, a lot of brain work, a lot of social organization, and that metabolism, you can sustain your tribe for months. That's massive survival value. But if you're vegetarian or vegan, then you are subject to the laws of nature. You're going to starve in the winter.
Yeah, that's so well explained. No, I know. And on the digestive note, I know so many former vegans and vegetarians who are then chained to, digestive enzymes or hydrochloric acid to help reset that gut and bring it back into the correct pH, because they've been giving it the wrong foods. And thus the body seems like it wants to be a little bit more alkaline in the gut in that situation, which is, like you said, not the way we were designed. So yeah, I love the way that was explained. I also wanted to ask you specifically about 2 things you talk about quite a bit. I heard you talk about these with Jesse. One of them does fall in the umbrella of carbohydrate, which is gluten, what the harms of gluten in particular, and also somewhat kind of falls in the umbrella of carbohydrate because it does contain most dairy products will have a little bit of carbohydrate. But those 2 things are 2 that you talk about in particular, and maybe you could educate us on why each one of those is so harmful for most people.
Okay, well, again, let's go back to evolutionary biology. Dairy products evolved for young mammals. If young mammals don't grow very quickly, then they get eaten by saber-toothed tigers. All dairy products are growth promoting, which for a young mammal is totally desirable. But for us oldies, we don't want growth promotion because that drives cancer. And we know that eating dairy products is a risk factor of breast cancer and probably prostate cancer as well. So that's number one reason why we shouldn't be eating dairy. Secondly, it's a major allergen. Dairy allergy is very common. Probably about 30% of the population are allergic to dairy products. And allergy drives inflammation, headaches, irritable bowel syndrome, asthma, etc., etc., etc. Another reason, they're a major risk factor for arterial disease and for heart disease. Why? Because, well, firstly, the milk protein makes for sticky blood. That gets the thumbs down. Secondly, the proportion of calcium to magnesium in dairy products is very high. 10 parts calcium to 1 part magnesium. Great if you're a young man with growing bones, but calcium and magnesium are absorbed by the same mechanism, so they compete for absorption. If you're having a lot of calcium, you're going to induce a magnesium deficiency. And that is a major risk factor for high blood pressure, for heart disease, for poor mitochondrial function, and much more. Essentially, calcium contracts and magnesium relaxes. So, and of course, dairy products have got sugar in them, lactose, which is, again, often fermented in the gut. Some people simply don't have the enzyme that breaks down lactose. And so this is a problem that is mega for them because they get terrible pain and bloating. But, regardless of that, the milk sugar is not a good idea because, again, it feeds cancer cells, it feeds yeast, it feeds bacterial infection as well. So, if you're not allergic to dairy, then butter is the only safe dairy product. I can get away with a little bit of butter, but on a carnivore diet, I'm very happy for people to have butter because, it's obviously a meat product. And then we had the gluten grains. And again, let's go back to our evolutionary past. Gluten grains have been around with this for about maybe 10,000 years, which is a blink of the eye in terms of evolutionary time. And it's worse than that because the bit that cooks love of wheat is the gluten. It's a protein. It makes foods, it makes flour sticky. It allows them to make bread that rises. It allows them to make croissants. It's got a great texture for cooking. But gluten sensitivity is extremely common. And I think gluten itself as a protein is quite toxic. I think gluten alone can drive leaky gut and all the problems that go with that. In fact, I remember going to a conference recently, and the consensus of the conference was that gluten-containing grains should be animal fodder only. They're far too dangerous for humans to consume because it's a combination of the gluten protein itself is allergenic and potentially toxic. Gluten grains are high in carbohydrates, which is bad for the upper fermenting gut. They're high in phytates and lectins, which are directly toxic. And of course, many are genetically modified, and they're going to be a lot of sprays on gluten grains. I mean, one of the problems of the farming industry is the amount of pesticide and chemicals that's used. And the one that's used probably more than any other one is glyphosate. And glyphosate is often used immediately prior to harvesting as a desiccant. So the idea here is, if you harvest a grain and it's still alive, it's still a bit damp, it's going to cost you a lot of money to dry it off in the grain stores. You have to blow hot air through it to dry it to stop the molds moving in. So it's much cheaper when the crop is alive, to spray it with glyphosate and kill it. So it stands in the fields, dead for a few days, and then it dries out instantly. And then you can harvest it dead, very dry. Drying grains cost nothing, and so you can produce a grain cheaper. But what it means is that glyphosate is going straight on that crop just before harvesting and straight into the human food chain. Now, Stephanie Seneff, who wrote an extraordinary book called A Toxic Legacy, which is all about glyphosate, she details how in America, glyphosate is used on crops at the rate of about 1 pound of glyphosate per member of the population per year. A pound of glyphosate, let's turn that to grams, say 450 grams. So it's possible that every member of the American population is consuming about 1 gram of glyphosate every day. Now, that's not a trace amount, that's a therapeutic dose. I mean, most drugs are given in milligram amounts. And here we are, with a pesticide at 100 or 1,000 times higher than that what we would use as a drug. and it's having devastating effects on our biochemistry. 54% of the microbiome will be killed off by glyphosate. Now, we don't know much about the microbiome, but the more diverse it is, the healthier you are. It substitutes for glycine, and that is essential to make connective tissue disease. Now, we're seeing over here epidemics of Ehlers-Danlos syndrome, poor quality connective tissue. Now, it's biologically plausible that that could be driven by glyphosate. It's a known carcinogen. And guess what? With cancer is just going through the roof at the moment. We're seeing cancers in breast cancers and bowel cancers in 30-year-olds. And that should never be. My grandmother was a GP. She never saw breast cancer in a woman under the age of 70. She said it just didn't happen in young women. Heart disease, it's a chelating agent, so it binds up minerals, so it renders all deficient in zinc and selenium and chromium, manganese. It's a mutagen. It's known to damage our babies, and so the risk of babies born with congenital abnormalities is increasing. And we know it's neurotoxic. It's an absolute disaster. So I want my PBs, my poor baskets, I want them to spend the money that they can get on the best quality food they can possibly access. Organic is ideal. If you've got a bit of garden, go and grow whatever you can possibly grow. Anything is better than nothing. But again, meats are more likely to be low in pesticides than vegetables and plants. So, our diet should be meat heavy, get organic eggs, fish heavy, because they are intrinsically less toxic than eating vegetarian or vegan diets. So
Yeah.
I probably strayed off the subject. I'm sorry about that. But
No, that was perfect. No, that was perfect. It's absolutely horrifying. I actually didn't know that about the dead plants and how that was harvested. So yeah, I really appreciate that. I had no idea about that. And you and I are of the same opinion that there's lots of different things that we can do, lots of different levers that we can pull. In my opinion, it sounds like in your opinion, the number one thing that most people could do is nutrition. If you had to
correct.
choose one of the things, what I've observed being in this world for the last, 7, 8 years in the low carbohydrate space is if you can get nutrition down, you're going to have a lot of wins that can eventually lead to other wins down the road. But that's where I would start. Not everybody's the same. Some people, it's other things. But if you expand that out to maybe, your top 3 or 4 things that you would tell most people, assuming that the first one is like, yeah, we need to get the plant foods mostly out. We need to go animal heavy to whatever degree somebody needs to, whether that's a full, very strict carnivore diet or maybe a lion diet versus just going, lower in carbohydrate. What are some of the other lifestyle practices that you end up talking to people about the most?
Okay, well, I say take a basic package of supplements that we've discussed. Vitamin D, vitamin C, iodine, really important. But now I'm coming to the view that we are all poisoned without exception. And many of those poisons reside in our fat. I used to do a lot of fat biopsies, which is a very easy test to do. Just stick a green needle into some fat, pull the needle out, and the fat within the bore of the needle is sufficient to do an analysis. I have never seen a normal result. We all carry a burden of toxic chemicals. And I now know we can get rid of those toxic chemicals with heating regimes. And the idea here is you get hot, which might be if you've got the energy to go for a run or to sunbathe or to sauna or have a far infrared sauna or a warm bath or whatever. And that mobilizes those chemicals onto the lipid layer of the skin. And then wash it off with a shower. And to say I've done fat biopsies or DNA adduct or translocating protein, some tests of toxicity before and after. And roughly speaking, 50 such heating regimes will halve your total body load. Now,
Wow.
you never get it to zero. The numbers come down exponentially. So if you start off with a notional load of 64, you do 50 and it comes down to 32, another 50 it comes down to 16, another 50 it comes down to 8. It's the law of diminishing returns. But we are all poisoned, and we can all do heating regimes. They're inexpensive. They can be incorporated into our daily life. So in the mornings, that's when I'm most likely to exercise. Not every morning, but I either do weights or run or whatever, and get hot, and then I have a shower, and that washes off these chemicals that should dissolve, get into the lipid layer of the skin, and then I replace that lipid layer of the skin with maybe some coconut oil mixed with shea. In fact, I'm in the process of making up a detox cream that anybody can make up. It's very simple. 50% shea butter, 50% coconut oil, and I put a big dose of vitamin D in there and a big dose of vitamin C in there and mix it all in, and that makes what I call my detox cream. and I put that on, maybe 15 mils. It's cheap. I say anybody can make it. It's very good for the skin. You put clean fats on, and you wash the dirty fats off after exercise and a shower. If you can't exercise, a warm bath is perfect, or sunbathing is great. Get out in that sunshine. The more sunshine you get, the happier I should be. Or if you've got a sauna, if you've got the luxury of that, then that's even better. But I now know that we are all poisoned without exception, and we all need to do the detox regimes. Casey, I'd love to send you my 2 chapters on this subject, and if you can send that round, or we can do maybe another interview about why we're all poisoned, then I would love to do that too.
That would be amazing. Yes, I would love to keep this conversation going, and I think that's a wonderful tip. And all of this stuff, like you said, for what did you call them? Poor buckets? Is that right? Poor buckets?
Say that again.
The PBs,
Oh
poor
yeah,
buckets,
the poor baskets I call them. This is
baskets. Okay.
slightly polite way of saying poor bastards. But
Yeah.
they're the
Okay.
people
That's fine.
that they don't have money, and they often don't have the money because they can't work, and they can't work because they've not got the energy. So
Right.
it's a real vicious cycle. So I have to find regimes that people who are less wealthy can afford, can include in their life in as frictionless way as possible, so it's sustainable. So they have half a chance of turning things around and getting better. And that's what it's all about. I mean, let's face it, we're all on a health journey. We would all like to be healthier. As I say to all my patients, life is not a battle, it's a war. It's a war we have to fight harder as we age. It's a war that we know we're going to lose. But I looked after an old boy who'd been through the Second World War. He came to me when he was 95, and he died last October, aged 102. And
Wow.
his brain was completely intact. He was a great raconteur, told great stories. He had no heart disease. He had no cancer. He just went to sleep and dropped off his perch like that. That's how we need to live. That's how I want to go, and I'm quite sure that's how you and all our listeners want to go as well.
Absolutely. Wow, what an amazing conversation. This has been fantastic. And on behalf of all the other poor buckets out there like myself, we love that this is being democratized and shared, because you're right. Like if there is somebody listening or watching who thinks, exactly what you mentioned earlier, that meat is too expensive, it's prohibitive, eggs are expensive, I really hope they would reach out to some of us, because I tell you what, in the 6 years that I've been carnivore, I'm spending way less money on food. And ultra processed food is so bloody expensive right now. Like you could live on a carnivore diet for just a few bucks a day very easily. So somebody needs help or tips or tricks, they could reach out to either one of us, and we'd be more than willing to kind of help them out.
And the most important food is offal. I went into town the other day, and I thought, I hadn't got any liver out the teacher, so I'll pick some liver and some heart. This butcher says, "Oh, nobody asked for those. We don't sell that." And I went into another butcher, and I bought a kilogram of liver, a kilogram of hearts, and a whole load of peritoneal fat for less than £10. I mean, it was so
Yeah.
cheap.
Yeah, they can't give it away. Exactly. Yeah, that's amazing. Dr. Sarah Myhill, this has been an awesome conversation. Like I said, I really, really appreciate your work, and thinking about what you just said about this is a war, not a battle, and you leading by example, with all the complaints you've gotten, not from your clients and patients, to continue speaking up about all the things that you talk about, I think is wonderful. So really appreciate the time. Would love to do another episode down the road. That would be amazing. Again, your passion is just so infectious and amazing. But for now, where can people go to find you and connect with you and your work?
Oh, just go to drmyhill.co.uk. It's my website. It's free. It's had 31 million hits, and if people want to buy my books, they're there. But there's 500 or 600 pages of information there that they can scroll through and pick up stuff. I run workshops here at my home, which are good fun. I run online Zoom workshops, which are good fun. So I try to make it as easy as possible for people to access the information.
That's fantastic. We'll definitely tag that in the show notes. And I mentioned in the introduction 2 of the books you've written, and also mentioned that you've written several. How many books have you written total? There's quite a few.
Oh, 7 or 8, something like that, I think. Yeah,
But
but various
when you
aspects of
lose,
medicine.
yeah, when you lose count of how many books you've written in your life, that's pretty impressive, I must say.
No, it's just because I can't count. That's
That's
much more
amazing.
likely
Well,
explanation.
there you go. Well, you should have become a personal trainer like myself, because my clients accuse me all the time of not knowing how to count. So anyway, Dr. Sarah Myhill, thank you very much for all of your amazing work and for making this so accessible for people out there. Really just appreciate you and your amazing message. And thank you for taking time out of your busy schedule to be on our show today. Really appreciate you.
My absolute pleasure, Casey. My absolute pleasure.
Thank you very much. And this has been another episode of Boundless Body Radio.